Hello, everyone. I'm Solomay Tibabu, the host of Going Digital Behavioral Health Tech. Thanks so much, Adrienne, for joining us today. Really looking forward to our conversation about your experience with employee benefits. To get started, can you give us a brief intro on yourself and your work?
Absolutely. And first of all, I just want to let you know I've really been looking forward to this and really excited about chatting with you today. So, just as a brief background from a professional perspective, I'm the retired head of benefits at American Airlines, where my team and I were responsible for the oversight of all things benefits administration, benefit strategy, for all of our health benefits and disability plans, along with all of the finance and accounting functions. So the majority of my career was spent in human resources. So, background in talent management, training, succession planning, but my true passion really is employee benefits and healthcare. I loved the work because I felt like there was always a challenge that I needed to solve for. So, it was really fulfilling that way. But, I decided in 2020 that I was ready for a change. And so decided to retire from American. And after a brief hiatus of spending some much needed time with family and also practicing some of my own much needed self-care, I decided to start the Camille Group. So the Camille Group is a strategic consulting advisory firm. Most of my clients are in the healthcare space and have included hospital systems, digital healthcare startups, and also employers. So I work with digital healthcare startups and hospital systems who are trying to sell in the direct to employer space. And so really using my experience as a former buyer of those types of products and services to really help my clients. So we work on things from, a pricing strategy to really help them to develop their value proposition, from the perspective of, marketing to potential clients, and really also helping them to understand the perspective of benefits buyers and the things that HR leaders and benefits leaders deal with. And then also, as I mentioned, with large employers, I work with them to help them develop their short and longer term benefit strategies.
Thanks so much, Adrienne. That's amazing. You've been in the employer benefits space for well over a decade. Can you talk about some of the mental health benefit programs you worked on?
Sure. I will say the evolution of mental health benefits has certainly been interesting. And I will say probably until, the last couple of years, were really probably more stagnant than they should have been. Just to be honest and direct, I would say that mental health benefits were more of, or took more of a check the box approach. So, when I first started, most large employers, as American did as well, we provided an EAP service. But I will tell you, we really struggled with getting utilization, and EAP always sort of felt like the stepchild of benefits, so to speak. And so I would say, much of that had to do with, the stigma that has been around for so many years related to mental health. And, also working in a highly unionized environment like American was or is currently, there's also that fear of the employer having access to mental health information could impact, employment, and also other potential substance abuse related issues. So, EAP was one. And then, obviously, a lot of benefit plans cover in-person mental health visits with licensed providers. But, as we know, the shortage that has existed for many years of in-network licensed therapists is dismal. So, people have always struggled with waiting for, weeks, if not months, to get in for in-person care. As I think about health benefits, employers, and this is not, to sound like an excuse, but, because employers have really been subject to really inflationary medical trend, and because of the competing priorities that have been on plates of employers, their strategies are really designed around, those types of things that are really costing the most in healthcare plans, and those that are really driving healthcare trend. And so, unfortunately, mental health care, until, as I mentioned recently, never really rose to the top of priorities unless it happened to be a comorbidity like anxiety or depression related to chronic conditions or acute high-cost conditions, or in or outpatient substance abuse care. And so, I would say we've made some tremendous strides during the course of the last couple of years. So employers, are definitely seeing an increase in utilization, which is great. But it's interesting because, even though there is that increase, they're not really seeing it as much from a claims perspective. So that also presents unique challenges as employers are considering different strategies for mental health.
Thanks so much. That's a great explanation. And especially given these last couple of years, as you've mentioned, there's been so much change. What are your thoughts on the current landscape of offerings, particularly digital health?
Absolutely. And so, no secret, right, that the pandemic shined a light on the existing gaps within mental health care. And so there have been a lot of venture dollars, which, I think is tremendous, that, has really increased the number of digital health offerings that are in the marketplace. And so, while many things have happened related to the pandemic that have been terrible, when I think of the good of it as it really relates to mental health, I think of a few things. When I think about even existing offerings or new offerings that are in the mental health space, a lot of those, really have now mental health assessments, coaching, therapy that are layered in as offerings for, different types of physical conditions. So it's really providing a more holistic approach to care and care virtually. And then also increased access. You look at, companies like Lyra or Spring Health, who have done a tremendous job of gaining traction in the employer marketplace by closing the gaps of being able to provide access to therapists, which has been a longstanding issue, or at least for, to coaches. And so, they're doing a great job of increasing access by providing same-day service to people when they need it. And I think that's phenomenal. But I'm also loving just more of the diversity that we're seeing in digital mental health care. So, we're seeing many new ones that are coming to market that, have self-paced approaches, that, have coaching through text or chat. And so what I love about that is that, there's a much broader understanding that just like physical care, mental health care does not have a one-size-fits-all approach.
Those are all great examples. Thanks so much. What do you think mental health benefits will look like in the future?
So, that's a good question. And I want you to know, I vowed in 2020 that I would stop making predictions. So I'd like to tell you what I think it should look like. How about that? So, one of the things that I think about from a mental health care approach is it's not just about mental health benefits. It's also about the culture within the organization. So it's much more than just a benefits program that sits on a shelf. But I think about just benefits in general, right, is really being a part of a retention strategy. And so mental health care falls right in line with that as part of an overall retention strategy. So, I would say this. First and foremost, I think the best low-hanging fruit that employers can put into place is, as you know, many EAP programs and other programs have caps in place for, you can have X amount of visits for free or, low or no cost. I think that that's a really dictatorial approach. I think that employers should get rid of those types of caps. It's almost like the employer is dictating how long they think an employee should take to become mentally well. And so that's a bit of an archaic thinking. I truly think about mental health as an ongoing journey. It's also important that they make it affordable. As I think about mental health care a few years ago, if you were still in your deductible as an employee, right, you could pay upwards of $200, to get in to see a behavioral health therapist. And so for many people, that's not affordable over a longer period of time. So really creating a benefits plan and a benefits strategy that makes it affordable to people as well. So, obviously, the price of admission or cost of admission is offering, clinically efficacious mental health services. But as I alluded to before, the culture within the organization really has to be supportive of mental health as part of a total well-being strategy and really has to embrace it as such. So, as we think about the importance of physical well-being, mental health care holds that same status. And it has to be spoken about openly and within every layer of the organization. And I think those employers who really are going to get it right also have to really address issues that contribute to mental health stress within the workplace and do so in a meaningful way. So, if employees are saying that they're having issues with anxiety or stress, that's, related to the workplace, I think employers have to really take that seriously and do something about it, right? And that's why I say, it's not just about having mental health benefits, it's about making sure that mental health and wellness is embedded in your culture. I think about, the diversity of mental health offerings we talked about before, that there's not a one size fits all approach. And so, I think that employers and those who are really thinking about the diversity of mental health needs, along with the diversity of their workforce, those are the ones that are absolutely going to get it right in the future. And they have to think about the whole person, right? And the impacts of social, racial, and other economic stressors that just name a few that impact their people.
These are great hopes, not predictions, which I think
Right.
I'll have to steal that phrase. Too many people ask me for the predictions of future of mental health too.
Sure.
Those are wonderful. Thank you.
Yeah.
And now let me ask, so of course, employers, they're getting pretty fatigued by all of the many companies that are calling on them pretty regularly. Do you have any advice for startups of how they can rise above the noise and partner with many of these employers?
Absolutely. And I would say not only are employers fatigued, they're also wary. There are so many different digital health solutions that are sitting on the shelf with employers and not getting the utilization or the traction. And so employers now are really wary of, how am I going to make sure that I don't have just one more thing that's sitting on the shelf that my employees aren't using? So, it's really important to be able to talk with employers about those challenges. But also first, it's really important to have demonstrable clinical effectiveness for your product and not just, a general population-based data. Like, employers are really looking for true metrics. And those, as I also or just mentioned, who are really getting it right are putting in place pricing strategies that reward performance and are really putting their money where their mouth is, right, in terms of guaranteeing outcomes. And that's really what employers are looking for. The other ones who I think are more successful are those who are listening to the needs of the employer, who are listening to what their pain points are, what their goals are, and really helping the employer as a thought leader to understand how, your specific solution can help address those pain points. And I also think it's really important to be willing to be open to shaping your products, your tools, your communications to also align with the culture of that employer as well, so that the way that you talk to people or to their employees or team members really resonates well.
That's all really great advice, Adrienne. And maybe if I could ask the inverse of that question, are there any common errors you see from startups trying to sell the employer space?
There are a couple, that I've really seen, some of my clients and others struggle with. One is that there are some startups that have a really narrow focus. And so they might be very good at addressing one specific issue, right, or condition, but that may only really impact a very small percentage of an employer population. And so, while I think it's great to be an expert in terms of what your service or offering is, employers are really looking for broader solutions for their employees where they feel like, a larger percentage of their population would really take advantage of those services. So that's one. The other that I would say, and I've seen this with a lot of new startups, is, I think it looks really sexy, right? If you're able to go out and get, some really big employer logos right out of the gate. But the truth is, cutting your teeth on some smaller to mid-sized employers to really make sure that you're working out the kinks in, your business model and, approaches and strategy, I think is really key. Employers, larger employers, while some are willing to do smaller programs, are really looking for solid references. So really making sure that you're doing really well with the smaller to mid-sized employers, because reputation is everything.
The topic of point solutions versus platform debate comes up often at Going Digital Behavioral Health Tech. So
yes,
like your camp platform versus.
I am absolutely camp platform.
Mm-hmm. Got it. So I'd like to ask, you've given so much great feedback to us today, Adrienne, and I only wish we had more time. I could probably get one more question in, and I think it's important for audience members to know that it's not just mental health solutions that you're looking to address. It's like all these other areas as a buyer of employee benefit solutions. Are there any other areas beyond the behavioral health space that you're particularly excited about?
Sure, absolutely. And I'm super passionate about women's health. And so it's really interesting that you just said camp platform, because I really think that was a great segue just into a new project that I'm working on, which is really developing a platform as a digital gateway to different solutions that are very focused on women's health. And not just women's physical health, but also social and emotional health as well. So I'm really working with a curated group of digital health solutions inside of my platform who are very focused and dedicated in that area to female employees and the spouses of employees as well. So more to come there.
Excellent. That'll definitely have to be our next session. But thank you so much, Adrienne. And how can folks get involved in your work, or how can they get in touch with you?
Yeah, absolutely. So, you can find me, Adrienne Schneider, on LinkedIn, as the CEO of the Camille Group. And my email is on LinkedIn as well, but it's adrienne@thecamillegroup.com.
Thanks so much for taking the time to be with us today.
Sure, absolutely. I enjoyed it.